Okay, get this. Someone pops up with bird flu, right? The H5N1, the one we keep hearing about.
Right.
But get this, they haven't been anywhere near infected birds.
No kidding.
It's like, what? How'd that happen? Total medical mystery.
Yeah, it really makes you wonder what we still don't know about this virus.
So that's what we're looking at today in this deep dive.
Absolute.
We've got this article. It's all about this weird Missouri case.
Uh-huh.
Plus, it covers these outbreaks happening out in California and Washington State.
Right.
So we're going to break it all down. First, what's the deal with this Missouri case?
Right.
Then, why are people so worried about what's going on in California and Washington?
Okay.
And the big one, what does all this mean for, well, for us?
Sounds good.
So, back to Missouri. Someone tests positive for H5N1 back in September.
Yep, September.
But here's the thing. No contact with birds, no poultry, nothing.
And that's strange because that's how it's usually spread.
Exactly. That's how every other human case we've seen has happened, through contact.
Right.
So, right away, huge question mark, right? How did this even happen?
It's a head scratcher for sure.
And of course, health officials, they freak out a little, understandably,
Oh, yeah.
especially when someone in the same house starts showing symptoms.
Oh, wow.
Then, 6 healthcare workers who treated the patient, they get sick too.
So at that point, everyone's thinking human-to-human transmission, right?
That's what it looked like, yeah.
Which would be, well, a game changer.
Huge, yeah. But good news, more tests showed those healthcare workers, they didn't actually have H5N1.
Oh, okay.
So, phew, no human-to-human transmission there, at least.
That's a relief.
Dodged a bullet there, it seems. But hold on, the plot thickens.
What happened?
The blood work for both the patient and the person they lived with, it's a little iffy.
Iffy.
They each only had 1 positive blood test out of the 3 they need for a confirmed H5N1 case.
That's interesting. So not really a clear yes or no.
Right, very murky.
So they might have had it, they might not have.
Yeah, and this is where it gets kind of complicated.
Yeah, I see.
There are different ways to test for the virus, right?
That's right.
You've got the PCR test, that's the one that looks for the virus's genes,
Uh-huh.
that can show up positive even if the virus isn't active anymore.
Interesting.
Then you've got blood tests. Those look for antibodies,
Antibodies. Right.
which your body makes when it fights off an infection.
And those take a while to show up.
Yeah, so early on a blood test might be negative, but later positive.
Gotcha.
So in this Missouri case, the first patient, they had a positive PCR test.
Okay.
Which means officially they're considered a case.
Officially, yes.
Even though those blood tests were kind of wishy-washy.
I see. Important distinction there.
Really important.
So even though we're not exactly sure how they got it, they did have H5N1.
Exactly.
Okay.
So this Missouri mystery, it's still bugging everyone. But the CDC, they're pretty sure both the patient and the housemate were exposed to H5N1 somehow.
Even if we don't know the how.
Exactly. And they even compared the situation to using sonar on a ship.
So,
Yeah, something's down there, but you can't tell what it is.
like a whale or a submarine.
Right. Could be anything. Figuring out how these folks got infected is key to understanding this whole thing,
Absolutely.
Whether it's some new animal spreading it or something completely out of left field, we gotta know.
I agree.
Because it could change everything.
It could change everything.
So yeah, this Missouri thing might look like a dead end for human-to-human transmission. But it's really a big flashing warning sign.
A warning sign.
Yeah, that we still have so much to learn about how this virus works and how it spreads.
I see what you mean.
It's a little unnerving, honestly.
Yeah, I get that. Yeah, it really makes you think twice about this virus and what it can do.
For sure.
And while that Missouri case is kind of a standalone mystery,
Right.
what's going on in other parts of the country is, well, it's a whole different story.
Yeah, you're talking about those outbreaks, right? California, Washington.
Exactly.
This article paints a pretty intense picture of what's happening there.
It really does.
So let's talk California first. Nation's top dairy producer.
Right. Huge dairy industry.
And they're seeing a massive spike in cases.
They are.
At the time this article was written, they had 137 infected dairy herds.
Wow.
Plus, at least 13 farm workers had gotten sick.
And what's really concerning is the speed.
The speed.
Yeah, how quickly this all happened.
Like, how fast are we talking here?
Well, the first cases, they were reported in late August.
Okay.
And by the time the article came out, it had exploded.
So just a month, basically?
Basically, yeah.
That's crazy.
It is.
I'm trying to imagine the impact on the dairy industry.
It's definitely a big deal.
I mean, California supplies so much of our milk and cheese.
Right. So when an outbreak hits a farm,
Yeah.
They have to kill all the birds to stop it from spreading,
Right, totally.
which of course is a huge financial hit for the farmers.
Makes sense.
Plus, it messes with the whole supply chain,
Oh, right.
and that can mean higher prices for us at the grocery store.
So not only are the farmers hurting, but it could affect everyone who buys dairy products.
Exactly. It's a ripple effect.
Wow. So we've got California dealing with this huge surge. And then, as if that wasn't enough, Washington State gets hit too.
Unfortunately, yes.
This time it's a chicken farm, right?
A chicken farm, yeah.
And it's not just any chicken farm. This one's massive.
800,000 birds. Can you believe that?
800,000! Seriously?
Seriously. And to make matters worse,
Oh no, what else?
it's a different strain of H5 bird flu.
Different strain.
Yeah, and they think it came from wild birds.
Those migrating birds again, huh?
Yeah, they play a big role in spreading this thing.
Okay, so we've got 2 states, 2 major outbreaks, 2 different strains.
It's a lot to keep track of.
And what about the farm workers in Washington?
Oh, yeah, they're getting hit too.
Are we seeing that spillover from birds to humans there as well?
We are, unfortunately.
Oh, many cases.
2 confirmed cases and 5 that they think are positive, but they're still waiting on test results.
So this virus is jumping from birds to humans in multiple places with different strains.
It is.
Okay, I'm officially worried now.
It's definitely a situation that needs to be taken seriously.
Yeah, no kidding. I mean, what are the chances of this thing really getting out of control?
Well, it's hard to say for sure,
Right.
but remember what we talked about earlier? Reassortment.
Oh, yeah, the whole virus swapping genes thing.
Exactly.
That's not good.
Not good at all.
And the more this virus spreads, the higher the chances of that happening.
Right, the more opportunities it has to mix and match with other flu viruses.
And if a strain pops up that's as contagious as the regular flu, but as deadly as H5N1,
Yeah.
and it can spread easily between people.
Well, that's basically a worst-case scenario.
So we're talking potential pandemic territory.
It's a possibility we have to be prepared for.
Okay, so let's shift gears for a second.
Yeah.
We've talked a lot about the risks and how worried we should be.
Right.
But what can we actually do about it?
That's the million-dollar question, isn't it?
Yeah.
It is.
So let's dive into that.
So, practically speaking, what can we do? Like, to get ready for a possible bird flu outbreak?
Well, I mean, there are things we can all do.
Should I be stocking up on face masks, hand sanitizer?
You know, stocking up on essentials isn't a bad idea,
Yeah.
especially with flu season coming up.
True.
But there's no need to go crazy, really.
Yeah.
Some of the most effective things are actually pretty simple.
Simple. Okay.
And they're things we should already be doing to stay healthy.
Like washing our hands?
Exactly. Good hand hygiene, that's key.
My mom would be proud. She's always on me about that.
So, wash your hands often, really well, with soap and water.
Okay.
Especially after being out in public, touching animals, or handling raw poultry.
Raw poultry. Good point.
And if you can't get to soap and water, use hand sanitizer, the alcohol-based kind.
Got it. Hand hygiene. Check.
Yeah.
What else? Anything else we can do?
Staying informed is huge.
Informed. Okay.
Yeah. Pay attention to those public health announcements. The ones from the CDC and the WHO.
Exactly. They're keeping a close eye on things, giving us updates.
So I shouldn't just ignore those news alerts.
No, definitely read them.
Okay, what do?
The more you know, the better prepared you are, especially with infectious diseases.
Makes sense. What about masks? Vaccines? Are those things we should be thinking about?
Well, masks are always a good idea,
Yeah.
especially when there are respiratory viruses going around.
Right.
And if you're in a crowded place or, you're at higher risk,
They can really help.
definitely. And vaccines. Yeah, they're working on H5N1 vaccines.
Oh, really?
Yeah, some countries already have some set aside just in case.
Just in case. Yeah.
But developing vaccines, it takes time,
It's not a quick fix.
No, but it's a big part of the plan to deal with this virus long term.
Okay, so we've got the individual stuff down.
Right.
But what about the bigger picture? Like, as a society, how do we get ready for a potential pandemic?
That's where it gets complicated, but it's super important. We need really good systems to keep track of the virus.
Tracking systems,
To catch outbreaks early on.
Before they get out of hand.
Exactly. And to see if it's mutating, if it's getting easier to spread.
Okay.
And we have to be ready to take action if things get bad.
Action like what?
Quarantines, maybe travel restrictions, social distancing.
Stuff we did for COVID.
Yeah, those kinds of things might be necessary to slow it down.
And research is important too, right?
Absolutely. We've got to keep working on new vaccines, new treatments.
Always got to be one step ahead.
Exactly. We've covered a lot today, haven't we?
We have mystery case in Missouri, outbreaks in California and Washington.
And the possibility of a pandemic, it's a lot.
It's a lot to think about, yeah.
But I think the main takeaway here is this situation, It's not static.
It's changing.
It is. The virus is changing. Our knowledge about it is changing.
Makes sense.
And how we respond, that has to change too.
We flexible, adaptable.
Exactly. And that's why staying informed is so important.
Right, paying attention to what's going on.
Being aware of the risks and, taking precautions.
So to wrap up, it sounds like we started this deep dive with a medical mystery.
We did.
And we ended up talking about something way bigger, way more complex.
We sure did.
It's a good reminder that what happens in one place can affect the whole world.
Absolutely. It's all connected.
But even with all the unknowns, there are things we can do
There are.
as individuals and as a society
For sure.
to get through this, to protect ourselves and each other.
I agree.
So stay informed, stay aware, and most importantly, stay curious.
Couldn't have said it better myself.